Hello, welcome back to this channel. Today the topic of our video is pharmacokinetics. That is an important term in general pharmacology. So pharmacokinetics and pharmacodynamics are the two important terms in which pharmacokinetics are all the actions that are done by our body to the drug, including all its metabolism, absorption and excretion, and while pharmacodynamics are the effects that the drug does to the body. Basically pharmacokinetics is the what the body does to the drug, while pharmacodynamics is what the drug does to the body. Pharmacokinetics includes these four steps that are absorption of the drug, distribution of the drug, metabolism of the drug, and elimination of the drug from the body. Once the drug is absorbed at the administrative site, it has to be entered to the plasma. If it is injected through blood, that is IV, it directly enters to the plasma, while if it is taken orally, then the mechanisms of absorption of drug from this GI tract include passive diffusion, facilitated diffusion, active transport, endocytosis and exocytosis. In this slide, active and passive transport are shown. In passive diffusion or transport, a drug is or a molecule is passively transported across the plasma membrane because it is transported along the concentration gradient. That means from an area of high concentration to an area of low concentration. So it is transported through the aqueous channels or pores that are present in the plasma membrane, while in active transport a drug or any molecule is transported against the concentration gradient. That means from an area of low concentration gradient to an area of high concentration gradient. So it requires energy in the form of ATP, as shown in this example of sodium potassium pump that transport sodium from inside the cell to outside extracellular matrix in replace of potassium from extracellular matrix to inside the cell. Here again passive diffusion or transport is shown, where water soluble molecules are transported through the channel proteins that are present across the cell membrane into the cell, and fat soluble or lipid soluble molecules are transported along across the cell membrane, dissolved in the cell membrane directly. Here another mechanism of transport or absorption of drug is shown through GI tract, that is endocytosis. In the process of endocytosis, a particle that has to be transported inside the cell, when it comes in encounter with the plasma membrane, it causes a conformational change in the plasma membrane that causes the formation of the pseudopores, and then this plasma membrane encloses to form a phagosome that contains this molecule inside the cell that has to be transported. Phagocytosis is the term for the transport of solid particles inside the cell, while pinocytosis is the term for the transport of liquid, or here shown extracellular fluid, that is transported inside the cell in the same manner. Receptor mediated endocytosis is another term that transport the particles inside the cell through the binding of receptors on the plasma membrane, and then this same conformational change occurs that causes the formation of this coated vesicle that contains these particles that needed to be transported inside the cell, and this coated vesicle is coated with proteins that is inside the cell. There are various factors that influence the absorption of a drug when it is taken by oral route through the GI tract. First factor is expression of P glycoprotein. P glycoprotein is basically a transmembrane transporter protein that transports various molecules and drugs outside the cell for its excretion or elimination. It is expressed throughout the body. So when there is increased expression of this P-glycoprotein, it reduces the absorption of drug. Next factor is effect of pH on drug absorption. A drug passes through the membrane more readily if it is unchanged. That means if there is no change in its pH. When there is change in the pH of drug or the environment, then it reduces the absorption of drug across the cell membrane. Next factor is blood flow to the absorption site. When there is increased blood flow to the absorption site, then the absorption of drug through that site is increased. As in case of intestine, there is increased blood flow to the intestine as compared to stomach. So the absorption of drug is more through the intestine as compared to stomach. Next factor is total surface area that is available for absorption. When there is increased surface area, then the drug is absorbed more readily or more efficiently. So the surface area is increased when there is a brush border containing microvilli present on the surface, as it is present in the intestine. When this brush border containing microvilli is present, it increases the total surface area for a drug to be absorbed, and the absorption of drug is increased through this area in as compared to the surface area that does not contain this microvilli and brush border. As intestine contain this brush border containing microvilli, so the absorption of drug through the intestine is increased because of increased surface area as compared to stomach. Next factor is contact time at the absorption site. When there is increased contact time available for a drug at the absorption site, then the absorption of drug is more readily at its site. Basically, when a drug comes in contact for more time at the site, it is more absorbed. If this contact time is reduced through the GI tract, as in case of diarrhea, the drug passes more quickly through the GI tract, then the drug is less absorbed through the GI tract. Same when the food is present in the GI tract, it increases, slows the gastric emptying and dilutes the drug. Both these factors increases the contact time for the drug to at the absorption site. So these factors increases the absorption of drug at the absorption site. That's why a drug is more efficiently absorbed when it is taken with meal. Bioavailability is an important term that means how much the drug is biologically available in the systemic circulation, or the fraction of administered drug that reaches the systemic circulation. It is determined by comparing the plasma level of a drug after a particular route of administration with the plasma level of drug after an intravenous administration. That in the intravenous administration, a drug directly enters the circulation, while in other route of administration, a drug has to be entered into the circulation after passing the so many mechanisms. So bioavailability is basically the comparison of these two drug levels. There are some factors that influence the bioavailability that include first pass hepatic metabolism, solubility of the drug. That means if the drug is very hydrophilic, it cannot cross the lipid-rich cell membrane, so it is poorly absorbed. While a drug, if it is extremely hydrophobic, again it is poorly absorbed because it would be totally insoluble in aqueous body fluids. For a drug to be absorbed readily, it has to be largely hydrophobic, so it has some solubility in aqueous solutions. Chemical instability: if a drug is chemically unstable, it cannot be available to the circulation readily, such as penicillin G. It is unstable in gastric pH, so it cannot be absorbed properly, and similarly its bioavailability would be reduced. Next factor is nature of drug formulation that can affect the bioavailability of a drug. This slide shows the first pass hepatic metabolism of the drug when it is taken by oral route. A drug, when it is taken by oral route through the GI tract, it first enters to the liver through portal circulation, and in the liver it undergoes its metabolism by liver enzymes, for example cytochrome P450, and then the drug is available to the plasma through systemic circulation. This is the first pass effect of liver, that is, the drug is first or initially metabolized in the liver, and then it is available for plasma. In this diagram, a drug is also metabolized by the gut wall enzymes and by the bacterial enzymes that are present in the gut lumen. So next process in pharmacokinetics after the drug absorption is drug distribution. Once the drug is absorbed, then it has to be distributed. That is the process by which a drug reversibly leaves the blood circulation and then enters the interstitium and then the cells of the tissues. So again, there are some factors that affect the distribution of drug that include: first factor is blood flow to the tissue capillaries. Basically, when there is increased blood flow to the tissues, there would be increased distribution of drug to their tissues. Next factor is capillary permeability, that is determined by the structure of capillary and the chemical nature of drug. If the capillaries are discontinuous, that means that large areas of basement membrane would be exposed through which large plasma proteins and drugs can pass. Then the drug would be readily distributed. And if, as in case of liver and spleen, and if the capillaries has tight or slit junctions and continuous, then the drug would have a difficulty in passing through the capillaries. That is the case in CNS. So in the CNS, a drug, if it has to be transported, it needs a specific transporter of large proteins that would carry the drug through the capillaries into the brain. Next factor is binding of drug to the plasma membrane and proteins. A drug, if it is bound to the specific receptors or proteins that are present in the plasma membrane, then this transporter protein transports the drug more readily into the cell and tissues, and drug is more readily distributed. Next factor is volume of distribution. So volume of distribution is basically the fluid volume that would contain the entire drug that would be present in the body at the same concentration that would be measured in the plasma. It is basically calculated by dividing the dose of drug that is present in the body by the plasma concentration of the drug at 0 time. So the third step in pharmacokinetics is the metabolism of drug or drug clearance through its metabolism. The process of its elimination includes three major routes, that are hepatic metabolism, elimination in bile, and elimination in urine. Clearance. Clearance is basically the amount of drug that is cleared or eliminated from the body per unit time. Total clearance is complete estimate reflecting all the mechanisms of drug elimination, and it is calculated as rate of elimination of drug divided by plasma drug concentration. Half-life is basically the time required for the amount of drug in the body or blood to fall by 50% of its initial concentration. In first-order kinetics, the drug is infused at a constant rate and it takes 4 to 5 half-lives to reach a steady state. Half-life is basically determined by the two factors that include volume of distribution and clearance. Half-life is determined by this formula in which the half-life is equal to 0.693 into volume of distribution divided by clearance of drug. Reactions of drug metabolism include phase 1 and phase 2 reactions. Phase 1 reactions basically convert lipophilic drugs into more polar molecules by introducing or unmasking polar functional group, for example, hydroxyl or nitrate group. So these reactions include these kind of reactions that are reduction, oxidation, and hydrolysis with cytochrome P450 enzyme. That is an important mechanism of metabolism of some important drugs. Phase 2 reactions yield very polar or inactive metabolites of the drug that are then excreted by the kidneys. These reactions include conjugation reactions, for example, methylation, glucuronidation, acetylation, and sulfation. So after the drug is first absorbed and then distributed throughout the body and then metabolized, and then it has to be eliminated from the body after performing its function. So a drug can be eliminated by zero order elimination and first order elimination. In zero order elimination process, the rate of elimination is constant regardless of Cp, that is target plasma concentration at a steady state. In this process, a constant amount of drug is eliminated per unit time. It is basically a capacity limited elimination. Examples include phenytoin, ethanol, and aspirin use zero order elimination for their elimination. In first order elimination, the rate of elimination of drug is directly proportional to the concentration of drug. In this, a constant fraction of drug is eliminated per unit time. Cp, that is targeted plasma concentration at steady state, decreases exponentially with time. It is basically a flow dependent elimination. This graph shows zero order and first order elimination. In zero order elimination, a constant amount of drug is eliminated per unit time that indicates a straight line, while in first order elimination, the rate of elimination is directly proportional to the amount or concentration of drug. As the concentration of drug decreases, the rate of elimination also decreases. That indicates a slope in this graph. Thank you for watching this video. Stay tuned for watching next upcoming lectures of general pharmacology.